course, indeed, it's Health Tuesday, and we trying to understand your story of prostate. No, ilikuwa imechukua attention yangu kidogo, but indeed it really makes sense above creating awareness to the same. If you're sick, kindly go and check out, right?
Yes.
All right, so we are back on the Morning Drift. Of course, we're having a conversation on the kidney problems with Dr. here, who's helping us to understand the context behind all this. But above all, there is a point we wanted to really understand. There is also position on the kidney problems amongst children or in children. How's that encounter? And of course, Dr. had mentioned earlier that there's a position, also the situation that one can be born without a single.
No,
with one kidney.
Yes.
No.
Yes, with one kidney.
All right. So as we try to understand the development of all these, help us understand also the context behind kidney problems in children.
Thank you very much. I will start with a woman who is pregnant. When a woman is pregnant, they need to go for checkup in the hospital. This is where we check the blood pressure, and of course we'll also check the urine. And there are those who, when they are pregnant, they can also get what we call hypertension related to pregnancy. And now when it comes to, and that is very important, visiting the doctor when someone is pregnant. If the pressure is high, it is controlled. If the sugar is high, it is controlled. If there is any infection in urine, it is treated on time. However, now again, during delivery, we advocate for our women to deliver in a health facility that is also accredited, because if during delivery the child can pick infection when they are separating the baby and the mother, when they are cutting the placenta and the cord, if it is not handled well again, it means that that child can so easily pick infection. And we usually get children as early as 3-day-old. If they pick an infection during delivery, it means that child can so easily, the kidney can easily get affected as a result of that infection. And you know, the child will even start by maybe not breastfeeding, not passing urine, and maybe there is general hotness of the body, and you need to rush this baby to the hospital. Because for a very small child, 6 hours means a lot. You need quick intervention, meaning that as early as a child being born, within 2-3 days, the child can present with issues which may progress to kidney failure. And if we are not able to address this issue on time, we will start even the dialysis, we will start maybe giving antibiotic if the child had picked infection. Along the way, as the baby is growing, the children usually experience infection like for example, isomahoma. We need to treat them on time. If they have diarrhea and vomiting, and the child is not able to breastfeed very well, kindly take the child to the hospital very fast. Or if there is that ORS that is within reach, and you can prepare wanza kupeana before you reach to the hospital. Yes, and then again, you know, for our tribes in the Western, like for example, the Kisi, the Luya, the Luos, once a child is sick, they prefer to go and use what? Herbal medication. That herbal concoction is so toxic to the kidney, and some of them, once they're given that herbal medication, it usually causes the kidney to shut down completely, to a point once a child maybe has started that dialysis, they may not even open up. For example, like if it was just plain diarrhea and vomiting, the child is likely to respond very fast within 2-3 days, within a week, and the child is okay. So even our children can get kidney issues. Even when they get malaria, it needs to be treated on time. Yes. If
they get all these diseases, and we now get to the story on transplant.
Yes.
Of course, another child can also be a donor.
Not really. Okay, like now in our country, mostly we transplant children from age 9. So if a child required to continue on dialysis, they may continue on dialysis up to around age 9. Then from age 9, we can transplant. The higher age is around age 67. But now if you are getting a kidney from a donor who is alive. But if you are to get a kidney from a deceased person or someone who has died, of which right now the law is still being prepared to cater for this, where people in our country, they can get a kidney from someone who has died. And not only kidney, we have more than 8 organs, the eyes, the heart, the kidney, the liver. We can get from someone who has died. For example, somebody just suddenly got an accident and maybe they had written, I can be, if I die, kindly my organs. They can benefit more than 8 patients. So once the law is in place, we'll be able to, most of our patients are going to really benefit from that. But as in for now, we get a kidney from a live donor who is a relative, because the laws of Kenya are only allowing us to work with relatives. This is a brother, father, mother, sister, cousin, members of extended family, the way they are, they can help us get a kidney too. And a child can also get a kidney from an adult. That is a child who is from age 9. They can get from even a mother, an auntie, an uncle.
That is 50.
Yes, even if it is 40, it will still work and work very well.
Why not children below age 9?
No, we are supposed to get a kidney from somebody who can make a decision, someone who can sign a consent. So that means if
I
have allowed you to remove my kidney, and this person must have attained the age of signing a consent, which is over 18. But mostly in our facility, we prefer to remove from someone who is aged 25 years. Mentally, intellectually, this person can give a consent. If I want to give my dad, I have decided to allow the hospital to remove the kidney to give my dad.
So that's a donor.
That's a donor.
What about the patient? The patient that is below 9 years, maybe 5 years.
They have to dialyze until that age of within the country. But a place like South Africa, I think they also do donation for those who are below because of technology. However, when we are able to reach where maybe South Africa and other developed countries have reached, we'll be able to transplant children who are below that.
How does transplant happen? In your field, of course, you have some attachments in it.
Yes.
How do we do that?
Okay, this is what happens. It's a journey. We say that transplant is not an emergency, but it is a process that takes time. It starts by, we do counseling first and help the donor and the patient and the family understand the journey, the process, what we need to do. It takes around 6 weeks to prepare. Every week they come, they see the doctor, and then they are sent for several tests. They bring back the tests. The doctor is able to evaluate, are we safe going ahead with the same donor? Are we safe when it comes to the patient? And then once we are through with the preparation, the doctors will sit down and go through all those tests and give an okay, and they are given a date for transplantation. Both of them are taken to theater at the same time. Like in our facility, we have 2 theaters, where one theater is busy removing the kidney, the other one is busy preparing where the kidney is going to be put. And then after a few hours, they will both come back, and then they will be taken care of. For our donor, immediately post-transplant, because there is that incision wherever they were removing the kidney, of course you expect that if you've been cut somewhere, there's likely to be pain. And now because of the risk of getting an infection, we put the donor on what we call antibiotic just for 5 days. And after 5 days, our donor is ready to go home. Then our patient will come back to the ward, but we are going to take care of him up to around 7 days. We'll be giving antibiotic, we'll be checking on how that kidney is responding. We are going to introduce drugs which we call immunosuppressant to help the body so that it can retain that kidney. Then from around 7 days, we'll be ready now to discharge the patient to go home and come back for follow-up. The first 3 months, our patient will be doing frequent visits to the hospital. So we even allow them to go back to work, mostly after 3 months. But for our donor, we allow them to rest like for a month. But after a month, they are ready to go back to work. And after that, they can continue with whichever work. If you are a farmer, you continue with farming. If you are a mason, you continue with your work kujenga na mawe without any problem. And you're not on any special diet because you donated the kidney.
Indeed.
Yes.
I was looking at a picture here when we had the conversation on prostate. Then I saw it's like a small thing.
Yes.
That is within the males.
Yes.
Then of course there's at some point you feel uneasy at those lower levels.
Yes.
Are those also points of consideration for kidney problems?
Yeah, like every man who is over 50, just like a wellness checkup. As you are checking your blood pressure and your urine and even the sugar, you should make a habit of like every year to go for a frequent checkup on your prostate. If it is enlarged, you need to see a doctor that we call a urologist who maybe he may recommend a scan to see if it is how enlarged it is. Why? Because once it is enlarged, it can affect the flow of urine, and it can also block the way the urine is flowing. And as a result of blockage, it can cause the kidney to fail. And once the kidney fails, it can, you might start now being on dialysis. Why? Because your prostate enlarged, it blocked the flow of urine, the intervention were not done on time. And I know many of the men, they fear maybe the surgical intervention, but the doctor will journey with you, maybe through medication or maybe through that surgical intervention, and it may stop you from being a dialysis patient, because once it is done on time, it means you will recover, your kidneys are not going to be affected, and you continue with your normal life.
Indeed.
Yes.
I'm seeing also the kidney is just a few just above the reproductive system.
Yes.
Then of course we are having the urethra, and the bladder.
Yes.
Well, now we come to kidney problems.
Yes.
But are there points that we feel uneasy in terms of releasing?
Okay, what happens is that like you can experience a burning sensation when you're passing urine. Maybe you are having a what you call urinary tract infection. And or maybe you have a bladder infection, and you need just a simple checkup to the doctor and just a simple antibiotic to clear that. But if it persists, you may need a follow-up, which may help you not to progress to the kidney being affected up there. Yeah.
There are things that grow around people's body, either inside or one of the problems I encountered recently with one, we were having a conversation when we were coming to discuss about the kidney problems.
Yeah.
Alikuwa anasema that there's something that has grown in his anus.
That is like hemorrhoids.
Hemorrhoids, yeah.
Okay, hemorrhoids may not maybe so much affect, but I think if someone has them, they may need an intervention by the surgical team. The doctor will be able to examine and advise accordingly. If they need to be removed, it's going to be removed so that the patient hemorrhoids, yes.
Okay. So because once you visited the chemist or the hospital, what's the best place to go for the checkups? Because the chemist will say you just take some medicine and eat a potato.
It's good to know that chemists, you will find what we call a pharmacist. A pharmacist, doctor, and in the hospital you're going to get a medical doctor, and in the hospital you're going to be advised accordingly, and simple as in after checking in a dispensary, checking in a dispensary can still save your life. Yes. So do not just underrate it. Ini kale ka hospitali ka hapo kawangware. Just know it can really help you. It can make a difference between going for dialysis and living a normal life.
All right.
Yeah.
I want us to come to a conversation on now how will the Ministry of Health and the entire government department to consider kidney as a crisis.
Yeah.
But before that, there is this point on weight, sugar, and all the things.
Yes.
I believe there are people that are facing that crisis on weight. And is it a point of concern when we speak about weight?
What you are saying, we have risk factor for kidney disease.
Indeed.
If you have hypertension, it's a risk factor. If you have diabetes, it's also a risk factor. If you are a smoker, that is also a risk factor for you developing a kidney illness. Again, also, if you are obese, it's a risk factor. And that is why if you're able to visit the doctor, we usually bring the nutritionist on board, where they check on your weight and your height. Then they calculate what we call the BMI. Then you are told whether you are obese or you are not. Then they give you a program on how to lose weight. Of course, not a crash program. The nutritionist will tell you this is how much you can lose in a week, in a month, or maybe in a year. And then you'll be able now to plan on how to take care of your weight, so that you move away from that risk factor. Again, if in your family there is a history of diabetes, hypertension, and kidney disease, you are also treated as someone who is also at risk, and you need to take care of yourself. And taking care of yourself is the way I've said over and over again. A simple checking on your blood pressure, your urine, and also doing a check on your blood sugar. It's very, very important.
So kama familia yako mko na shida ya sukari?
Ya diabetes. Hiyo sukari sasa ndio hiyo diabetes. Yes. Kama kuna hiyo shida, you need to do a check-up. Yes.
I think they've learned and listened to what you've said.
Yes.
All right. So specifically, the estimated number of patients with end-stage kidney disease, ESKD, who require kidney transplants is to 12,500. By October 2022, about 6,300 of these patients were undergoing chronic hemodialysis treatments. Many of the rest did not qualify for dialysis after the defunct NHIF tightened the eligibility criteria. Now, the number of transplants in the country is quite low. From 2012 to 2022 only, 708 kidney transplants were done in Kenya, according to KRA in 2011. There were only 160 kidney transplants versus 5,700 patients who were only hemodialysis. This is a transplant conversion rate of 2.8% against rate of approximately 10% that has been observed globally. So why is this the case? Kidney transplant is considered better than dialysis because it offers a significantly higher quality of life, longer life expectancy, and eliminates the need for regular dialysis sessions, which can be time-consuming and restrictive. That is a statement.
Yes.
Of course, to understand where we are in fighting the kidney problems.
disease. Yes.
Then now we shift gears to the Ministry of Health, the government, in
Yes.
ensuring that all these patients
Yes.
are getting involved. You
Yes.
mentioned, of course, the theme for this year,
Yes.
the awareness. And how will the Ministry of Health now come in handy to
Yes.
support these kidney patients?
You see, like now they need to equip more hospital with doctors who can do the surgery. We have very few surgeons who have qualified to do that kidney transplant.
Indeed.
And you see, like in Kenya, we have Kenyatta National Hospital, we have Nairobi Hospital, we have Aga Khan, Mata, we also have Nairobi West Hospital. So you'll find, and Moi Teaching and Referral Hospital, just very few hospital who are doing this transplantation. Suppose we are able to increase the capacity and equip the hospital with the necessary equipment, train more doctors, and be able even to retain them, employ them, and so that they can do all that. It's going to really help us a lot. Also, train even more nurses and even employ more nephrology nurses so that they can support that work. It's going to really help a lot. Yeah.
Dr. Tabitha, of course, you're live on TV.
Yes.
I want to give you a chance now to speak to these kidney patients.
Yes.
And of course, to speak also to the government
Yes.
in terms of now support to all this, then we evade the kidney problems.
Me as a renal nurse and a counselor for renal patients, first of all, our renal patients, thank you very much. You are doing the best you can. Even sometimes as simple as waking up, getting to the sitting room, if that is all that you have done today, you have done your best. Employers, let us embrace our kidney patient. Kindly do not sack them. Yes, sometimes it may affect your business, but they need support. Their family needs to continue. We need to support them in terms of finances. They need to go back to work. They need to live a normal life. Our teachers, we need to understand kidney children. They need to continue coming to school. We need to support them. The day they are not there, let us make sure we have provided a way for them to do all the exam and even to do their homework when they are available. That particular day that they have not gone for dialysis, we need to support them. And the community, kindly, we need to understand our patient. Let's support them. Let us give them forum to express themselves so that we can even understand them better. We need to support them in terms of finances and being there psychologically, emotionally. We need to be present. For our government, kindly let us support, provide more machines, open more facilities, especially in the government hospitals, make dialysis accessible to most of our patients, and kindly train more nurses, train more doctors, and let us together fight kidney disease.
All right, thank you so much. I don't think there will be more better speech than that. That is lovely.
Thank you.
All right, so imagine going to get help abroad where we can get the help right here in the country or locally. Mind you, of course, kidney is becoming a crisis, but we're creating awareness, of course, right here from Look Up Television to across the world. So, ladies and gentlemen, that is where we end the conversation on Health Tuesday. See you next time as we dive into other conversations. And remember, the conversation matters when we speak about them. This is The Morning Drift. My director has been King Dantimax. Thank you so much. See you tomorrow as we dive into other conversations. My name is Moses Sketch. Thank you so much for your lovely time. Asante sana daktari.
Thank you. Thank you.
All right.